Welcome to Heartland Rehab podcast, where we break down health, recovery, and performance with some of the best minds in physiotherapy. So today we're talking about one of the most common and feared experience, pain. Whether you're an athlete looking for the optimal recovery journey or someone who just wants to learn a little bit more about pain, this episode is for you. Today we have Gareth, one of the co-founders of Heartland Rehab, who has worked with many individuals managing pain. And so to start off, could you tell us a little bit more about pain and why is it so important to you as a physiotherapist?
Pain is basically something that everyone experiences at one point in their life. Okay, it can be due to an injury or just a simple bump that causes you to feel a discomfort that you perceive as pain. I always tell my clients, pain is like a friend. Okay, yeah, so it keeps you from doing something that is dangerous to yourself. Okay, but after a certain period of time in that protective phase, when they have enough of that, yet some people still feel pain, and that isn't helpful anymore.
So it's kind of like if a good friend becomes an overly attached friend.
Yeah, you can think of it that way.
Okay, if that's the case, then should I continue to exercise through pain or should I just rest?
Okay, it really depends, because if you're talking about a traumatic incident that, let's say a fall where you sprain your ankle or you twist your knee and you feel an acute pain, means that very onset of pain, you should rest. Okay, meaning you should listen to your body when there's that pain. Lay off the activity for a bit. I would say anywhere between 3 to 5 days and see if it gets better. And if it doesn't, then you need to see a medical professional. If it gets better, again, there's no more pain at all, then you can slowly get back to your sport. But the principle of progression should always apply. So you shouldn't go straight back into what you were doing just before the injury. But you should kind of like progress and start at 50% and then bring it up 10%, 10%, 10% if there's no pain.
Right, so just now you mentioned like traumatic injuries and acute pain. So I'm guessing there's also like chronic pain. If there's acute pain, there should be chronic pain as well.
Yes.
Right, can you tell me a little bit more about chronic pain? And is that usually the type of people that comes into physio, or is it usually acute pain?
We see both kinds. So people who have acute injuries and it doesn't get any better after 3 to 5 days. We see many of them coming through our doors. We kind of do a differential diagnosis and we see if we can treat them, or we refer them out for the specialist to see, to get scans done, and then to be referred back to us if no operation is needed, or even if there's an operation needed, pre-op rehab is also good. Okay, least fracture. If you're talking about fracture, then definitely no physio. We'll do immobilization of that joint, but then again, other joints need to be worked on. The chronic pain is anything that is more than 3 months. Okay, a pain has been there more than 3 months, and swelling might be present. The pain might not be as high intensity as when it first happened, but the pain persists for more than 3 months. Then that's how we term it as chronic pain.
Would the treatment be the same as other types of chronic pain? I'm guessing like lower back pain. I feel like that's something that I've heard a lot. I think my dad, when we were much younger, he had some sort of injury on his back. I think it was like a slip disc, and he was in pain for over like 10, 20, well, almost 20 years, however long I was alive for. My dad was always complaining about lower back pain. Is that something you see very often as well?
Yeah, definitely. So that definitely is considered chronic pain.
Chronic, right?
Especially if it's the same area experiencing the same kind of pain or evolving kind of pains around that same spot. Yeah, so it's chronic pain.
So for these type of pains, how do they normally develop? From what I've heard, people are just like turning around from their car seats trying to grab something. They hurt their back, and they're telling me this story, and they said it happened almost 3 years ago. And I'm like, how does a twist to grab something from behind the car hurt you for 3 years? So I'm wondering, how does that develop?
Yeah, I think how you get injury, there are many different ways. It can be mechanical, it can be traumatic, it can be repetitive strain, meaning doing the same movement again and again, that leads to the acute phase of pain. And if it's not well managed, then it can develop into chronic pain, where it could be that the brain has already registered that pain signal and is just expecting that pain signal to always be there. It's learned that pain.
Learned that pain. Okay,
Yeah.
can you tell me a little bit more about that? What do you mean you learned the pain?
Yep. So in the initial stage of that pain, whenever you twist, you feel that same pain.
Right.
It's because it doesn't want you to do that same dangerous action.
Mm.
Okay? But every time if you kind of like keep trying and you keep feeling the pain, it becomes a pattern. Every time I twist, pain. I don't do it. And if I don't treat it properly, like go for physio, stretching out the muscles, strengthening the muscles, then every time I do it, there's always pain, right? So the brain learns that if I go into the action, there's pain. So it learns that pain, even though whatever that might be strained at that point of time has healed up over time, the brain still learns that every time I twist here, I should be feeling that sensation. So it no longer becomes a protective mechanism. It becomes that overly attached friend that tells you, don't do this, don't do that, don't do this, don't do that. Yeah, when you actually can.
Okay, so it sounds like pain is more than just like physical, mechanical, biological injury. It sounds like you can also learn pain. So it's psychological as well.
Yep.
So is it possible that you can talk someone out of pain?
A tricky one. Pain is basically how the brain processes a sensation.
Okay.
Okay, for example, if I were to maybe hit you like that, and you might say, that's really light, or you can say, that's really painful. Whereas if I were to hit Sarah, maybe, I were to just hit at the same, because she's so fit, right? And she say, it's like a fly swatting me. Yeah, so it's how the brain processes an input from the outside. So we call the central nervous system and the peripheral nervous system. So it's kind of like the peripheral gives an input to the brain. It's a processing center. Kind of say, is this dangerous? Should I process it as pain? If it is, then it sends a pain signal back to that spot and say, ow, pain. So it is a psychological thing. But I would say that to say that I can talk someone out of pain, would be a bit disrespectful to those who are going through pain.
Right.
Yeah, I would say that pain has evolved from a biosocial model to a biopsychosocial model.
Okay, explain it to me. What do you mean by biosocial and biopsychosocial model?
Okay, so if we break it down, bio, psycho, and social is actually three different factors that can contribute to this interpretation of pain. Okay, so when we talk about biology, so it can be a real injury. So let's say you really tore your muscle, and that should give you pain. Because if it doesn't give you pain, you're going to be using that same muscle and worsening it.
Right.
If you fracture your bone, it should give you pain. If you don't feel pain, you're just going to keep using or keep stepping on it, and the fracture from an undisplaced fracture can become a fully displaced fracture. You get what I mean?
Yes.
Yeah. So that's the biological part of it.
Right.
The psychological part of it is how we interpret pain. It can be the culture. For example, perhaps if you grow up in a environment where you cook a lot, so that kind of heat that you experience on your hand, after a while, you no longer feel it anymore, because the psychology of it is this is not dangerous. Although to someone who hasn't been doing it, the psychology is that, if I'm near fire and there's pain, means I'm getting burnt. I'll pull my hand away. But then for someone who has been doing it and say this is normal.
Right, yes. I can totally see that. My mom cooks a lot. And so when I touch a hot pot, I tend to move my hands away immediately. But she will come to me and be like, it's fine, you're not going to get burned. And she just like wraps the whole pot and be like,
just a bare hand or with just a thin cloth, right?
Yeah. So that's like a good example of someone learning what should be painful and what should not be painful?
Or rather, what should be dangerous that leads to a pain protective, and what is not dangerous, then it just becomes a normal sensation.
Pain protective and normal sensation.
Correct.
So that's the cycle of the biopsychosocial model.
Correct.
Then what about the social?
So the social part of it can be various things. For example, how much stress there is in your life, whether you are supported, whether you are getting enough rest, whether you are, it's a culture thing as well. For example, maybe in a certain culture, for example, there are some cultures where piercings are quite normal, and although it's painful, people accept it and it becomes okay to have that pain for a while. Yeah, so it can be a cultural thing where it's okay, don't have to be too worried about it. Yeah.
Right. So it depends on culture as well and the people around you.
Yeah.
So is it possible? I'm just wondering if, let's say you see your parents, like say you're a kid and you see your parents, like if they touch something that is sharp but it doesn't bleed, doesn't cause them any physical harm, and they always have a very stuck reaction, like let's say they touch the edge of this and they go like very, very often. Is it possible to learn that from someone as well?
Yes, definitely.
So that's where like really the social aspect comes in as well. It's possible for us to learn pain from our observations of the people around us and not just from our own experience as well.
That's right.
It sounds like pain is quite complex, right?
Yeah.
There's a mechanical injury, the bio portion, and then there's the psychological aspect of whether you have learned whether the pain is harmful or not, and then there's the social aspect of your culture and the people around you that can all impact the way that you feel pain.
Correct.
Right.
Even let me just touch even on the stress and that social part of, if let's say you're feeling stress.
Right.
We all know that stress releases cortisol and a lot of this kind of inflammatory contents in the body, and we know that inflammation heightens pain. So even a small pain, but because of, let's say, lack of sleep and a stressful environment, can enhance the pain or amplify the pain such that it becomes something that is unbearable.
Right.
Yeah. So sometimes you might be wondering, this is such a small thing. Why are you, making such a big fuss over it, But you need to find out what's happening in the background as well. Are they going through a stressful period? Are they getting enough sleep? Like sometimes even, I'm a new parent. So I understand when people don't get enough sleep because of their baby. Yeah, so that lack of sleep sometimes can also cause a certain pain, like for example a headache that is usually bearable to be amplified and become unbearable.
So what are the most common types of pain that you notice, and do you feel that it's more bio, more psycho, or more social between the most common pains that you see?
I think one of the more common pains that I see is lower back pain. Okay, and then neck pain also.
Right, those are the two pains that sometimes I myself get as well.
Yeah, it's something that I would say is a generational pain. Like our forefathers, maybe our grandparents, they usually don't get this kind of pain. They probably get knee pains, shoulder pains because of the manual labor that they do.
Right.
Whereas for us, we get a lot of lower back and neck pain because we sit at our desk a lot. Okay, so the lower back from sitting, and then the neck from the computer and the phones.
Oh, that's me. Like sometimes I do get it as well.
Yeah,
it's like
it's
if
me as well.
Too long.
Yeah. Okay, so for lower back pain, let's talk about chronic.
Yes.
Okay, chronic lower back pain. A lot of them come in having a job that needs them to sit for long hours, and some of them have maybe a gym after a long day's work. Some of them don't. They basically just sit for work and sit for leisure. Okay, so prolonged sitting. Prolonged sitting, we all know, causes a huge strain on the lower back. Whether or not it's biopsychosocial, which one is more focused or a bigger percentage of it, actually it's really hard to tell, because there are some that are really very happy people, but they really have that biological pain because of that repetitive stress. then it really is very much on bio because of that stress. Then it might be like 70% biological, maybe 10% psychological, and then 20% social because of the stress level.
Right.
It's going to be hard to tell you what's the majority of my clients like, but yeah, many of them come in with that low back pain, and they ask me, if pain, then how? Yeah, so I usually tell them, respect pain, but don't be afraid of it.
Right. What do you mean by respect pain and don't be afraid of it?
Okay, so especially for the chronic ones that don't have red flag symptoms. Okay, so I'll talk about what red flags are in a bit, but the chronic ones, or the ones with chronic pain, I tell them to respect pain, means listen to pain. The pain is there, but we know that it's not damaging. For example, if you are sitting for long, it's not gonna cause your muscles to tear or your bones to break. Okay, but it is complaining. I would say that the pain is your body complaining that there's a lot of stress in the area. So physical stress, not my boss give me so much work. That stress that is going through the lower back,
right,
because of long hours of sitting. So I tell them to respect it, meaning what can you do to reduce that pain? Movement. So some of my guys tell me movement is lotion. Or motion is lotion. Motion is lotion. Yeah, so very fancy. But I agree, it is true. Motion is lotion. So I tell people between 45 minutes to an hour of sitting, then you move. Just have to move for maybe 2 to 3 minutes. Go get a cup of water, go to the washroom, just stand up. If you have a standing desk, then from sitting, move to standing.
Right.
Just move out of position. Yeah, I also like to tell people the best posture is your next posture. Yeah, there's no, people ask me, is it good to sit like that? Or do I lean back? Or I'm actually doing this a lot. So I tell them that it's really based on the setup, but even if you have the best setup and you sit there for 10 hours,
it's still going to hurt your back.
There is always that stress.
Right. So it's not so much of finding the optimal posture. As we're talking about back pain right now, I'm like, am I like sitting up straight and everything?
Yeah, it's about movement. So you see,
movement, right?
I'm always fidgeting.
Okay.
Because I have an old injury to my back. So the way I manage is to strengthen it and movement.
Yes.
I just keep moving.
Right. And if you keep moving, it doesn't
I won't feel the pain. Yeah.
Okay, so it's not so much of finding like the best chair for you to sit down in the most optimal posture and stay still in the perfect posture, right? But it's to keep moving.
Correct.
Stand up, sit down, grab a cup of coffee, grab some water.
Yeah.
And you mentioned just now about 45 minutes to an hour.
Yeah.
That should be about the limit before we just move about.
Yeah. So sorry, with someone who has chronic pain, then I will ask, how long can you sit before that discomfort sets in? And I use the word discomfort. So I don't want my clients with chronic pain to keep thinking about pain.
Right.
Yeah, so they do feel that discomfort already, and we keep saying that discomfort is pain, that discomfort is pain. I'm teaching them or reinforcing a certain belief system that what they are feeling is bad and is pain. So I use the word discomfort more often than not. So I acknowledge that they feel pain, but I use the word discomfort so that it doesn't become dangerous.
Right.
Yeah.
So that's where like the psychological part comes in.
Correct.
And that's where like the talking someone out of pain also kind of comes in.
In a way, that portion helps. And then of course then the movement part, which is that therapy of moving.
Yeah. And now that you mention it, I do remember a time when I did have low back pain, and then this is when I was much younger. I did have an injury, and then after a while, it kind of became a bit chronic. And now that you mention it, it really wasn't painful. It was more discomfort.
Yeah.
But because of the discomfort, and I've already associated it with pain, therefore I became extra afraid of it. Now everything that you're saying kind of links back together, right? And because of that, I start to feel pain.
Yeah.
But on hindsight, it was just discomfort.
Yeah.
I think slapping myself on the wrist is actually more painful than the discomfort that I felt.
Yeah.
But somehow that seems to affect me and my daily life a lot more.
Yeah.
And then I became afraid to move as well, afraid to bend down.
Yeah,
I
correct.
was much younger than that. And
Yeah.
as you mentioned just now, the key to preventing it is actually to keep moving.
Yes.
Don't sit in one position for too long. So I was actively going against what was going to help me.
Yeah.
And I can foresee a lot of people doing that as well.
Yeah, they don't want to move because pain makes you immobilized just by
Yeah.
nature of it. You feel pain in your wrist, and then you don't really want to move it anymore because you don't know if you move it again, the pain comes on.
Yeah.
So the pain function, I say, is your friend. It stops you from doing something that is dangerous to your body if there's a real injury inside. But once we've cleared it with scans and we've done our tests and we know that there's no imminent danger,
Right. Yeah.
that's when we start to want people to move gently, so graded movement. Yeah. So if let's say moving like that is painful, I get them to move to just to pain and then stop, just to pain and stop, and this works for the back as well.
Tell me a little bit more about that. So you mentioned that if someone is experiencing pain, the way to resolve it is to move into pain and then return. Is that how people get better or overcome chronic pain?
Yeah. So I always tell people I want them to move in a pain-free range or as little pain as they feel or discomfort that they feel. So on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain. For ladies, I tell them it's like giving birth, that kind of pain. That's 10. For guys, thankfully we don't experience that. Okay, it's like getting your toes run over by a car, that kind of intense pain. So that's 10. I always tell them that keep it between 0 to 3, maximum 4 out of 10 when they move. And so once we know that there's no structural or danger in moving, and then that's when we encourage them to move within that 0 to 4 kind of range, so that if they keep moving and there's pain, like I say, the brain learns the pain. So I tell them move within a acceptable amount of discomfort and keep going until that amount drops. Like say if you're feeling a 3 at this range, okay, you just move up to a 3. Do it a couple of days. When you don't feel like it's a 3 anymore, bring it up a bit higher. So over time, when the discomfort keeps getting lower, I keep getting more range and more function.
Right. So it's working into the pain, just barely, about 0 to 4, and then you come back down.
Yes.
And after we scan and there's no mechanical injury, there's nothing wrong with that area, there's no damage, then eventually your brain may learn that, hey, this is fine, and then like the pain itself will reduce.
Yeah. So the brain will interpret that discomfort no longer as pain, but just a sensation that you feel. And once you go through it, it gets used to that new range, then it becomes normal.
Right.
Yeah.
I guess it's because it kind of goes through what you mentioned just now. Like there's a sensation when you're moving your arms. Let's say you have a shoulder pain, and your brain interprets when you go up to a certain length, that is interpreted as pain, and so you feel it. But as you keep doing it, and your brain realizes that, hey, there's no harm, there's no damage, it will interpret that sensation as a sensation.
Yeah.
It does not have to be painful.
Yeah, and it becomes normal, so it normalizes.
Wow.
Yeah.
So coming back to neck pain and lower back pain, how long does it take for someone to really overcome those pain and discomfort along the neck and back?
I would say that if someone manages to change certain things, for example, their workstation. Remember we were talking about that, like, it's not about the chair, okay? It's true, motion is lotion, but having a good setup allows you to feel less stress, okay, while you're in that position, which means then you can go longer. But it's not asking you to go longer. It's so that in that 45 minutes to an hour, the body is under an acceptable amount of stress. You get what I mean? So if someone is doing this for an hour, it's gonna be super painful. Yeah. So people who do video editing, who look at spreadsheets, that's what I noticed, because you need just so much detail. You're just going in and going there, and you're just so in the zone. Yeah.
That's usually me. I always catch myself doing
Yeah,
this.
yeah. So your forward neck posture, the chin poke.
now I'm listening to talk about it. I'm
Yeah,
like,
you're
oh,
starting
my
to feel it.
positions.
Yeah. So I tell people that try to set it up in such a way that you're not in this aggravating positions. Okay.
Right, yeah.
That helps. So if you manage to revamp your workstation, that's helpful. If you manage to keep to that 45 to an hour movement, that's helpful. And then you strengthen your muscle, that's helpful. I would say that if someone who has had maybe pain that just started recently and you start reversing all this and strengthening, between 2 weeks to a month, they will see a result. But if you've been experiencing the pain for years, then it won't be as quick for us to solve that pain. But it will take a while for you to learn new habits. So unlearn and relearn. So new habits, and then for the body to get used to that new posture that is less stressful, or that new habits that's less stressful. So it might take between even 3 months. For lower back, I've seen even up to a year.
Oh wow, okay, that can be quite long.
Yeah. So it's also setting expectations. So understanding that unless you can totally offload and just strengthen, the body will take time to heal up.
Right.
Yeah.
Offload and strengthen. So if someone focuses a lot on strengthening their muscles, their back, their neck, their shoulder muscles, will that have a major impact? Or would it be okay if someone is like, you know what, I'm completely lazy, don't ask me to work out, I'm just going to change my setup and walk around a lot?
Yeah.
Do you see that helps in most cases, or is the strengthening portion very vital to the healing?
I would say that those who actually change their lifestyle and they move every 45 minutes to an hour, that reduces the stress or takes away that prolonged stress. Generally, they feel a lot better already. The strengthening, I tell people, is to bulletproof your neck and your back. It's really bulletproofing, because you never know when the next time your job needs you to sit for long hours. For example, maybe year-end closing. And then you're suddenly back to 3 hours, 4 hours, and then it just flares up everything.
Right.
Yeah, then it goes into this thing called a boom-bust cycle. Yeah, where booming means you are doing well, no pain, you feel really good. And then you start going back into your old habits because you feel really good. And then you bust, bam, it goes down. Right. And the bad thing about this boom-bust cycle, it actually affects the brain. It causes changes on the brain that then eventually leads to chronic pain as well, because you keep experiencing this pain, no pain, pain, no pain, pain, no pain. And then the brain starts to just expect pain is going to be there. And each time you bust, it's going to be more painful than the previous one.
Oh.
Yeah.
Oh man. I did not know that. I didn't know that you could repeat the cycle and it gets worse. I would think you'll get better.
No, yeah. So if you keep going through that, and that's when the strengthening comes in.
Right.
Which is why I say strengthening bulletproofs it. So, for example, assuming, let's say we count by percentage. Let's say the neck strength. If you're sitting there and you're looking at a computer and maybe 3 hours you're 100% and you start to feel a bit of ache, right, at 100%. If you start to do exercises for the neck and all that 3 hours might become 5 hours. So it can take that 5 hours, for example, before it fails.
Right.
Okay, but if you're moving every 45 minutes to an hour, then we don't have to worry about being in a position for 5 hours. Yeah, but if you are working 12 hours a day, then the whole issue of do you have enough rest? Are you very stressed up, and then your body, and that all leads to pain as well. Right. So that's where the biopsychosocial model is always at the back of our mind, and you will always go back to it. Yeah, but so strengthening is bulletproofing. Yeah.
And I guess strengthening will be very important because as we age, generally, I'm guessing our threshold will keep declining.
Yes.
Over as we age.
If you don't do anything.
Yeah, and we don't exercise.
Yes.
And that's why I think exercising will probably help you increase that threshold for a much longer period of time.
Yeah.
Okay, so for the two most common chronic pains, neck pain and lower back pain. So right now we know that we should set up our workstation in a way that we are able to move about a bit and also not in a very compromised position for too long.
Yep.
And we also need to exercise and strengthen those muscles.
Yep.
What exercise can we do? Simple one that we can just say it right now, that can help strengthen our lower back and our neck to increase that threshold. Is there like a universal exercise for that?
Yeah, assuming, let's say we go back to red flags again, assuming we clear the red flags. Okay, so red flags for the lower back will be things like saddle sign, paresthesia, so like numbness and tingling around the underwear region, burning sensation down the leg, sudden weakness into the leg, urine and bowel incontinence. Okay, sudden, it's like suddenly you can't control your urine and your bowel movement. Okay, those are red flags, meaning something is compressing on your cord, spinal cord, and you have lost control of those areas. It's an emergency. You need to go to the A&E, get the spinal decompression. Okay. So for the neck, similar, if you suddenly have slurred speech or you cannot move your hands, it's painful, burning sensation, giddiness that suddenly sets on with all this, then you want to go to the A&E as well. Okay, so that we put this aside. So that's what the physios and the medical professionals do.
Right.
We screen before we give treatment.
Okay.
So assuming all these are screened and you don't have any of these signs, then for the lower back, what we can do for strengthening, very simple ones in sitting, is a bit of a pelvic tilt in sitting. Okay, so it's about how you tilt your pelvic forward and backwards. Okay, so that works the pelvic floor muscles, that works all the other muscles that support the lower back as well. Okay, it moves it and it works it as well.
Pelvic tilt.
Yeah, pelvic tilting.
Oh, mine's very weak. I can feel it being a bit jittery.
Yeah, so some people ends up compensating with their back movement. They end up extending their spine rather than moving their pelvis. So that's one compensation. So I usually tell people, think of Michael Jackson. He does very good pelvic tilts.
Yes.
So watch his videos, go and do it, okay? So that's one. So for the lower back, that's one. The second one, good exercise to do would be bridging. Yeah, so glute bridges, where you lift your buttock up. In supine, in lying on your back. Okay,
Right.
so you press your foot into the ground with your knees bent. That activates the thigh, the front thigh muscle, your buttock muscles, as well as the core. Okay, you shouldn't feel too much stress in the lower back when you're doing that. Okay, so bridging helps as well for lower back. Okay, there are other kind of strengthening exercises like targeting the multifidus, which is the deepest muscle in the body. But it's going to be hard to explain it. So it'd be good if you can see a physiotherapist that can bring you through all this. Okay?
Right.
For the neck, we always tell people to strengthen the neck. There are some isometrics, meaning resistance without movement. So you can go forward flexion. Okay, so you're just resisting.
Right.
Extension, so you're resisting. Side flexion. Okay, rotation. Okay, and then the neck flexors. So I like to do this against the wall, where you're not retracting like a tortoise. Okay, what you're doing is actually sliding, so you're kind of going. It's more of a knot than a retraction. But to put your head against the wall, the back against the wall, and then just sliding like that. That works the deep neck flexors. That helps to support the head. Yeah.
Okay, so these are some of the basic exercises that can potentially help once we clear all the red flags.
Yes.
So make sure you have no numbing running through your legs. You can go to the toilet well. No slurred speech. Your hands are fine. All these kind of things are cleared. Then you can potentially try these things at home.
Yes.
And if it doesn't work, come see a physio.
Yes.
As it should be.
Yeah, don't wait too long, or not it becomes harder and harder to treat.
One last thing I want to talk about, just now you mentioned about like nerve compression and all of that. Reminds me a little bit about slip disc. So does everyone who have a slip disc, do they have to go for surgery, or can they just see a physio and deal with the pain?
Okay, good question. So I do get a lot of my clients asking me that. So if you have slip disc with this red flags, then please go straight to the A&E.
Right.
If you do have a disc that is protruding, okay, we use the word slip disc because everyone understands it, but it gives a very catastrophic kind of image, like, oh, my disc has slipped out. Okay, many a times it's just bulging. Okay, so in between the two spinal columns, because there's increased compression, then the disc bulges out.
How does the disc bulge out? What do you mean by that?
Okay, so the disc is actually like a hard gel. I would say a hard gum.
Gum.
Yeah, so it's not water. Okay, don't think of it like a water bag and then it's like flowy kind of thing. It's actually a hard gum inside. Okay, so our spine, which is round, when you compress it like that, it works fine. It's built to take this kind of compression.
Yes.
But then when you start to, like say for example, you start to slouch.
Right.
Okay, assuming this is the front, this is the back. When you start to slouch, okay, there's more pressure at the front and less pressure at the back. And material likes to move from high pressure to low pressure. Right?
Right, yeah.
So when there's high pressure, you keep pushing to the back. The disc can bulge out and stay within the ring that protects it or keeps it in, which is called the annulus. Or if there's enough traumatic of force, it can actually tear through the annular, and we call it annulus tear. Okay, so that's when you have a very high load at the front, okay, or whichever way you load it, and it causes the disc to go in whichever direction.
Right.
And then that's when you get a disc bulge. So it can be from prolonged sitting where the annulus wears out and then the disc bulges out, or it could be heavy lifting. So that's why we say if you're lifting something heavy, try to keep your back straight, okay, and lift from the legs.
Right, so that you don't put too much compression force onto your disc, which is like a gel.
Yes.
And that way you don't like squeeze
Cause
it
it
out.
to come out.
Right.
Yeah, and so if we go back to that question, where you're asking me how many of them actually need to do an operation?
Yeah.
I would say I would tell people to observe first. Usually from the onset of that pain and maybe even some nerve sensation into the legs, if it's bearable, take the medication that a doctor gives you. Please go and see a doctor for sure. The doctors might give you certain painkillers, muscle relaxants, or even some nerve medication.
Right.
Okay, to help to kind of like settle that acute phase of what you're feeling. After maybe 3 to 5 days, that initial pain should come down, and after 2 weeks, it should be bearable. I wouldn't say it will go away totally, but it should be bearable, it should be more functional. So after maybe 3 to 5 days, you should be walking more. So within that 3 days, maybe for the first day you can rest a little bit, do some bed exercises.
Right. Yeah.
Okay, and then get out of bed. The faster you can get out of bed, okay, with bearable pain, so that's why you take the pain medication. Okay, and then you go for just walks in your house, okay, or even out of your house, somewhere that is easy for you to get back if you're feeling tired. Okay, that will actually help recovery faster. Staying in bed the whole day is going to make it worse.
So movement is lotion.
Motion is lotion.
Motion is lotion. Yes.
Correct. So then after 2 weeks, if the pain is very much bearable, then we know that possibly conservative treatment will be the way to go. If the burning sensation is still there, you feel weakness in your leg, doesn't go away at all, then perhaps you might want to consider some form of surgery. So medical technology has come so far. They have different kinds of surgery that isn't just a fusion to the spine.
Right.
Yeah, 10, 20 years ago, what they would do is do a disectomy, cut out that part that is protruding,
Right.
and then fuse your spine.
Right.
So
Just
that
like
it doesn't lock it in.
place.
Yeah, so rods,
Right.
screws, then that column will not cause you problems, but it's locked in.
Yeah.
Yeah, so you feel
lose
a
that
bit of
flexible-
stiffness, you lose some flexibility.
Yeah.
Yeah, so I
They
would
don't
say
do that There are
They
more
still
things
do,
these
they
days.
still do, but it really is dependent on what the specialists see, and it's their zone. I won't dare to comment on it, but
Right.
it's their zone. So that's where I trust the doctors that I refer to. If they say that, okay, all you need is annuloplasty, where they kind of like suck this back into place.
Oh, you can do that.
Yeah, they can do that.
That's interesting.
Yeah, so like I say, medical tech now.
Oh, wow.
Very amazing. Then then that's what I would say. Go ahead with that doctor. If they say, "Oh, we've got to fuse you," then he or she has his reason.
Right.
Then I will respect what the doctor says.
Yeah.
But either way, as long as there's no red flags, always try a period of at least 3 months of rehab first. See how you go. If you're on the track of improvement, then stick with conservative.
Right.
Of course, working together with the specialist. So you can either see a spine specialist. Okay, and once they do the clear MRIs and all that, we know what's happening. They will help in the pharmacological sense until you need to do an operation.
Right. Yeah.
If not, you can also see a pain specialist.
Pain specialist.
Yeah, so these are doctors that specialize in treating clients with pain.
Oh, wow.
Yeah, acute pain, chronic pain, as long as it's not like a fracture. Okay, then there's like chronic pain where the structures are not in danger.
Yeah.
Then these are the ones that you might want to go to, pain specialists, because they understand and they are more well versed in this whole chronic pain issue.
Right.
Yeah.
So it really sounds like pain is something where if it's not going to be harmful, like a mechanical injury, like a fracture, where if you keep applying stress, it will get worse.
Yep.
It sounds like it can be managed and modulated through time, through exercise, through certain more conservative approach, and that seems to be like a better way rather than just completely avoiding the pain, ignoring it, and just not moving at all, or just jumping straight into surgery. We should always try to see whether we can manage it conservatively. I mean, it saves you a lot of additional cost and a lot of
Downtime,
problems like downtime as well.
Yes, correct.
Yeah. And speaking of downtime, just now you mentioned some people may need to go for surgery.
Yep.
The last time we were talking about ACL, I think Bala was mentioning about this cross bracing protocol, and that's very time sensitive. If you leave it there for too long, then you will not be able to use a cross bracing protocol. As he mentioned, the ligaments would simply get absorbed back into the body.
Yes.
What about this case? Is there like a time frame where we should be more like cautious about, or we should try to adhere to, or would a surgery done, let's say, 2 weeks from when you have your slip disc or prolapse disc to like 2 years, will there be a significant difference?
So for the surgery itself, no. But why I say if you do conservative for up to 3 months, remember what's the definition of chronic pain?
Oh, it's 3 months.
3 months. So if
Right.
within that 3 months you're not getting any better, and it's unbearable, you can't function,
Right.
that's when I would suggest consider an operation.
Right. Okay.
Okay, so 3 months would be a good period where you should feel improvements with movement, exercises. Of course, take your painkillers. Yeah, take your painkillers. A lot of people are afraid to take painkillers.
Yeah.
Remember, we were saying that every time you do a movement and there's pain, your body learns the pain.
Yeah.
So you imagine if you have a medication that can block the pain, and we know that it's safe to move. We need to know it's safe to move.
That's number one.
So then we block the pain, get people to move within pain-free range. The body recognizes that it's pain-free, and then it starts to relax the muscles, okay, that are overguarding, and it starts to strengthen the muscles that need to strengthen to support the spine, for example. And then you can start to wean off the painkillers after you can move well.
Right.
That's why I tell people, if it's really painful, please take the painkillers. We don't want you to keep moving and feeling pain. And I start teaching the body that, if you do this, it's going to be painful.
Right, because your body would learn and associate certain movements with pain. Yes. So the painkiller kind of stops that cycle part, right?
Yes,
and the association with it.
Yes.
Nice. Okay, wow. Thanks so much for that. I think I've learned quite a bit about pain today. I've learned how to prevent developing chronic back pain and how to prevent it. I know that moving about, getting a good station, and exercising just seems to be something that is very important and can help me with that as well. Yeah, man. Thanks so much for for all this. I hope that you guys have learned something today as well. I've learned a lot. I've learned a lot about pain and how to avoid it, and also when to embrace it and go through with it. So if you guys have any questions, leave it in the comments below and we will try our best to answer you as well. And remember, if you are feeling pain and you're not too sure what to do, see a doctor or see a physio as well.